One day you're walking fine. The next your legs feel numb, your vision blurs, and no one knows why. Welcome to the unpredictable world of multiple sclerosis. Multiple sclerosis is an autoimmune condition that affects your brain and spinal cord. With MS, your immune system mistakenly attacks myelin cells. These are the protective covers that surround your brain and spinal cord nerves. Myelin shift damage interrupts messages that your nerves send throughout your body to perform functions like vision, sensation, and movement. Myelin damage can occur in your brain, spinal cord, and nerves that supply your eyes. There is no cure for MS, but treatment is available to help minimize ongoing damage and help you manage symptoms. There are four types of multiple sclerosis. You can think of the types as a way for your provider to describe your symptoms instead of being four different conditions. Clinically isolated symptoms. This is when you have the first episode of symptoms suggestive of MS. Both don't meet the criteria for having MS. Healthcare providers often categorize it as a CIS. Inflammation and myelin damage cause your symptoms. CIS may develop into multiple sclerosis. Next one, relapsing remitting multiple sclerosis. RRMS. This is the most common way that multiple sclerosis begins. An estimated 85% of people diagnosed with MS have this type. MS causes flare-ups of new or old symptoms. Periods of remission follow. Next one, secondary progressive multiple sclerosis, SPMS. In many causes, RRMS eventually progress to SPMS. In the secondary progressive stage of multiple sclerosis, nerve damage accumulates and symptoms gradually worsen. You may still experience some relapses or flares, but periods of remission are less likely to happen. Next one, primary progressive multiple sclerosis, PPMS. In some cases, MS symptoms may start off slowly and gradually worsen over time from the very beginning without any periods of clear relapses or remission. Early signs and symptoms of MS include change to your vision, optic neuritis, double vision, vision loss, and muscle weakness, usually affecting one side of your face or body or below your waist. Numbness or abnormal sensations, usually affecting one side of your face or body or below your waist. Common symptoms of MS include fatigue, clumsiness, dizziness, difficulty with bladder regulation, loss of balance and coordination, difficulty with cognitive function, thinking, memory, concentration, learning and judgment, mood change, muscle stiffness and muscle spasms. These symptoms vary from person to person and may fluctuate in severity from one day to the next. You may have a few of these symptoms, but it's unlikely you'll experience all of them at once. This can be challenging to predict because everyone perceives normal in their own way. With MS, you may have periods of remission where your symptoms go away and you feel more like yourself. You might even forget you have MS until symptoms flare up again. This feeling of normalcy and the degree of normalcy can vary by type and stage. You may be more at risk of MS if you are between the ages 20 and 40, if you are of Northern European descent, if you are female. MS can affect anyone, rarer cases can affect children. Diagnostic testing helps your provider rule out conditions with similar symptoms to MS. Testing may include blood tests and urine tests, magnetic resonance imaging test, MRI, optical coherence tomography, OCT test, lumbar puncture, evoked potential EP test. Experts aren't sure why some people develop MS. Research suggests the following may contribute to an elevated risk of developing MS: smoking, toxin exposure, low levels of vitamin D, exposure to a virus, and obesity during childhood. If your primary care provider suspects you may have MS, they may refer you to see a neurologist. Thank you for being with us until the end of this video. I hope this video helps you to know enough about multiple sclerosis and symptoms of it. If you are interested to know more about medical world, don't forget to subscribe our channel.